exactly right in the center in the low?
So center, and then it would float off to the right.
Yep.
Back to the center.
Yep.
Right at the base of my spine.
Yep.
So it had really been ramping up the last 3 months.
Okay.
Yeah. So I'm at regular CrossFitter, as you know.
Yep.
And the first instance was a deadlift.
Yep.
Yeah. So I had a little bit of low back lingering issue over the years.
Yep.
And I would tweak it occasionally, maybe once a year, go see a chiropractor, get an adjustment. Things would be fine, I would come back up again.
Yep.
I picked up the heavy deadlift, and I hadn't properly warmed up for it. Felt a little tinge. That's when it first started hurting.
Yep.
Went to get a chiropractor adjustment, felt better, came back and just jumped right back in without any really additional treatment. And then it was a heavy back squat that I got stuck on, tilted forward, and it compressed. I would go, then I'd go see a chiropractor, like, okay, now I think I'm good, and then I would come back, and a week later, or 2 weeks later, I would do something dumb again, and I'd be right back in the same spot. You saw me rolling around with a lacrosse ball and a foam roller. I don't really know what I'm doing. I'm just trying to relieve pain somehow, some way. Yeah, it's frustrating. So I have 3 small boys. So the kids know when I did something to my back. So I'm avoiding wrestling. I'm just feeling pain getting up out of bed, and then beginning to impact what I can and can't do. In the CrossFit gym, which is a bummer, I'm just feeling limited and kind of foolish, honestly, a little bit. Lots of lacrosse balling and foam rolling.
And would you find any effect on your symptoms?
Temporary relief in some instances, but nothing that was really effective.
The symptoms persisted, and then you came and said, well, let's get an appointment.
I just had a light bulb moment. I mean, you've been really kind and gracious and generous. You'd never really asked that of me.
Yeah.
And I thought, hey, what if Jason knew what was going on and could fix this for me? He understands CrossFit. We have that connection.
Right.
So let me just jump in with him and see. I was real curious about, because I'm used to coming from a chiropractic background. I'm used to the adjustment, like the fix. Right. And then you just walk out and you're better. Right. So I was curious to see, and I just remember being really impressed with the time you spent to understand. Like I just felt heard by you. That was the biggest thing I went home and told my wife. Like, I feel really empowered that I know what I've been doing that's wrong. You still got me limited on some of the heavy bar stuff as we're kind of ramping up now, but just feeling a lot of confidence in bending movements. We've done some squats again, deadlifts, and just going back to that bar, picking it up and not feeling that pain. It's just been awesome. So confidence is still in the rebuild, but leaps and bounds over where I was
when you start to feel something or think that you might feel something, do you have tools and strategies, and what are they?
So I felt a small tinge and immediately knew, hey, drop to the ground, did some press ups. Throughout the day, I'm doing a couple of these leaning back bends. So I have a very clear, I know exactly what I need to do. The biggest takeaway has been the empowerment that I have what I need to take care of my own back. Just knowing that I feel in control of the balance of, I can go hard in the gym, I can lift, I can go be with my kids, and if I feel anything, or if I do a certain movement that might have been a trigger for me in the past, I know exactly what I need to do to begin that process, to pull back and to begin to establish that normal healthy function. So just that feeling of empowerment, and for the day-to-day, like, actually it's a little bit simpler than I thought it was.
When